information for everyone. Everyone meaning everyone on Medicare. This is my first presentation of this open enrollment, so I might be a little rusty, but we're going to get through it together. I see a lot of familiar faces, which is good, so I'll ask you questions and see if you remember what I said from last year. If you have questions along the way, just interrupt me. I'd rather that than try to wait to the end, because then we'll kind of forget what our questions were. So if you don't understand something I'm saying, if you can't hear me, just let me know. I don't have a fancy PowerPoint. I tend to go off paper because I want you to have something to write on. Everything in this packet is color-coded so that you can kind of go back after the presentation and follow, kind of remember what I said by following the colors. And, all right, not exciting information, but crucial information nonetheless, right? Medicare isn't exciting, but we need to know what it is. There are some changes going on with the Advantage plans and the drug plans, and so we need to be aware of what's happening. And so what we tend to do on these presentations is to make sure that everyone has an understanding of what Medicare is by itself, because in order to understand how it's changing or what I need to do, I really need to have a basic understanding of what Medicare is, and not everyone does. So the first thing that we're going to start with is this cover sheet. Now you notice on this cover sheet it's kind of divided into two sides, right? We have this side with the green and the purple and the dark blue, and then on the other side it's all in yellow. And that's because when you're a Medicare beneficiary, you actually have two options with what you're going to do with your Medicare. Some people don't realize that, but you do. The first one is to keep original Medicare and add things to it, which would be the colorful side. And the other option that you have is to kind of replace original Medicare as your primary insurance and replace it with what's called a Medicare Advantage plan or Medicare Part C, which is the yellow side, which is why it's all in one color. So first we're going to talk about the colorful side here with the original Medicare. And when you look at the original Medicare here, we know original Medicare has how many parts on your card? When you look at your Medicare card, how many parts are on there? Two. We have Part A and we have Part B. And that's here in the two green boxes. Now when you flip over to the green paper, however, you're going to notice that it's still reflecting 2016 information, because 2017 information has yet to be published for us. So we're still waiting on what they're going to do with the Part A deductible and the Part B deductible and stuff like that. We're still waiting on that. So this information is still 2016, but we're going to use it just to get an idea of the coverage that one has when you are just using original Medicare. So if everyone looks on the, make sure you're looking at where it says Part A on the top. You should have the green paper where it says Medicare Part A benefits. If you're not with me, let me know. Okay. I think my person that put my packets together was a little... That's okay. So Part A, who knows what Part A covers? What are the two major things that Part A covers? Who can give me a guess? Inpatient hospital, what else? And skilled nursing, right. Those are the two major things that your Medicare Part A covers. Now does it cover 100%? So if I go in the hospital as an inpatient and all I have is my Medicare card, I didn't add to it, I didn't replace it. Do I have 100% coverage for that inpatient stay? No. No, because that would be too good to be true, right? So first we have a deductible. So whether we stay 1 day or up to 60 days, we have a deductible of currently it's how much?
80%?
No, it's $1,288. Does everyone see that? So when I go in, whether I stay 1 day or whether I stay up to 60 days, if all I have is Medicare, that hospital is going to bill me for that deductible, which right now is $1,288. It might change, but right now it's still $1,288. What happens if I stay longer than 60 days, maybe up to 90 days? What happens? How much am I paying then? $322 a day if I just have Medicare. And we don't have long hospital stays too much anymore, right? But still, if you had a long hospital stay and you just had Medicare, you can see where your costs are going to really start to escalate, right? Which is why a lot of people just don't have Medicare all by itself. Let's go down to the next box. Say I had a surgery and then they wanted to send me over to the rehab to skilled nursing. If I stay 1 through 20 days, how much am I going to pay? Zero. Medicare is going to cover the first 20 days. I'm not going to have any out-of-pockets. But what happens if I stay longer than 20? $161 per day. That's going to be a little expensive. Now the average skilled nursing stay is around 13 to 14 days, so we might get out and be discharged before day 20. But if we don't, it's going to be a per day fee for us. So again, having original Medicare all by itself is good coverage, but you might want to be adding something to it so we're not responsible for those big out-of-pocket costs. Okay, so that's really Part A in a nutshell. Two big things covered under Part A. Your inpatient stay and your skilled nursing stay. Any questions on that? So we're Part A experts.
So your medics would pick up the balance, correct?
Okay, let's flip that paper over and let's talk about Medicare Part B. Is Medicare Part B free? Are we paying anything toward our Medicare Part B every month? Oh yes we are. How much are we paying?
I thought it was like 120.
Well, it could be all different things at this point, right? So you all could be paying something a little bit different for Part B. Currently, the Part B premium is $121.80. We don't know what's going to happen in 2017 yet. Which depends if you all receive that COLA, the cost of living increase. Because if you receive the cost of living increase, then they can move up your Part B premium. So some people might still be paying the $104.90, I believe. Some people might be paying the $121.80. And when the new rate comes into place, there might be a third set of people paying the new rate if there's no COLA increase. So we haven't
already paid in notice-wise from Blue Cross.
Yes. So we'll see how the Part B premium plays out in the news.
Can I
Yes.
also say something? This is the reason I came. I'm as sick as a dog, but I came because I'm upset. I have written for the past 2 years to everybody, Medicare, Social Security, and all. I got no response from anybody to do anything. I have a few stocks, but I am limited because I have to pull it out now. They have tripled my Medicare payments and doubled my drug appointments. It was less than that in 2015, but now they increased it again. I'm paying altogether with the Blue Cross supplement that I pay $601 and change per month.
Okay.
And I'm livid.
I understand because you're putting out a lot of money every month,
Yeah.
right? And that's why we like to come out and hold these information sessions. Because what we can do is we can look to see where we can save a little bit money.
Well, that's the reason I came.
We could change all the government in this room with us, boy, we'd have a great time, right? But some things are a little harder to change. So what we have to do is look at the things that we have the ability to change, which is looking at those plans, trying to look at that drug coverage, trying to figure out where am I going to get the biggest bang for my buck? Because we don't want to ever pay more than we have to. Some things we can't change, but some things we can. And this is our opportunity to make changes, right? October 15th through December 7th is when Medicare gives everyone an opportunity to look to see what's going on, make your changes, and then that's going to start for January 1st. Go ahead.
Just FYI, my sister hit mass cash and she won $100,000, okay? She only receives from Social Security $791 a month, okay? Who can live on that? Her premiums went up to over $200 a month because of that winning. So that's just information. She tried to fight it because she said it wasn't earnings, it wasn't this. Someone said, oh, you have a case. She took it further. She didn't. She gets $500 and change a month from Social Security and has no pensions, and she has a mortgage.
Right.
So she still has to work, she's 72.
So there is a lot going on, and we just have to, take it in stride. If you have questions, you can ask Wendy. You have 2 Shine counselors here at the West Bridgewater office, right? You have Wendy and you have Fran. You always have us at the regional office in Middleborough. You can call us and ask us questions. Let's just carry on.
Yes.
Okay. Hopefully by the end, if you don't if you can maybe see how things can change within this seminar and you can change things, that's great. But if you need to have a one-on-one with someone, you can have that opportunity too, to really go over the details of your own situation, your finances, your medications, and stuff like that. So I think we might have a lot of people looking for appointments after this. But let's get through the general overview first. So what I wanted to talk about was Part B. So we know we're paying a monthly premium for Part B. It's generally coming out of our Social Security check. If we're not collecting Social Security, then the government is billing us monthly, and we're not sure what that is going to be in 2017, but we're waiting for that information. So what does Part B cover? Anyone have a guess on what Part B covers? Doctors, specialists, ancillary visits, emergency rooms, if you took an ambulance, if you had an outpatient surgery, if you were going to a PT therapy, you're doing outpatient therapy, all of that is going to be covered under your Part B. So we tend to use B a little bit more than we tend to use A. And how does Part B work? So if I only was carrying that Medicare card and I didn't do anything else, what is my coverage? 80% after we pay the annual $166 deductible. So first I'd be responsible for the first $166, then Medicare would pay 80% of the claim, and I would be responsible for 20% of the claim. Do we want to be responsible for 20% of that claim? Not necessarily, right? 20% of an office visit might not be so bad. 20% of an outpatient surgery, 20% of a CAT scan, 20% of an emergency room visit, that's where our costs are really going to increase. So that's where you see people adding things to Medicare or replacing the Medicare to have a little bit better coverage than that 20%. So when you look at that green page, that is original Medicare in a nutshell. There is no drug coverage included in original Medicare. That was something that was added to Medicare in 2006, therefore it's a piece that one has to add. That's it, original Medicare. So if we go back to our original page here, we think to ourselves, okay, I have this original Medicare. I'm not too crazy about what you said about it. I'm not too crazy about those deductibles and the 20%. I'm not crazy about there's no drug coverage included in there. Now what do I do? And this is where the choice comes in as to what you have for choices. You can stay with the original Medicare, or you can replace it with the Medicare Advantage plan. So say you want to keep the original Medicare. What would be one advantage of keeping original Medicare as your primary insurance? Does anyone know? You can go anywhere you want.
Yeah.
It's an open network. It's a nationwide network. So you have the ability to go wherever you want. You don't have to use a referral system. So people that like that freedom and flexibility to be able to go where they want to go and not worry about the contracts and the networks and the referrals will probably keep original Medicare as their primary insurance. If they spend significant time in another state, they're probably going to keep original Medicare as their primary insurance. This is going to allow them to have the same coverage in that state that they do here at home. That's why you would keep original Medicare. But we talked about that green page. We talked about original Medicare, and you probably want to add some things to it. And the first thing that you want to add is what? Prescription coverage. You want prescription coverage. The government's going to penalize you if you don't. Even if you're not on any medications, they want you to carry a drug plan, a Medicare Part D plan.
Why?
They want to use the government,
Who are they?
Medicare. I am not Medicare. I only tell you about Medicare. What they want is everyone to be insured against high-cost medications. Now, we know, as
Whether
we've
you
all
need it or
seen in the
not.
news, what's that?
Whether you need it or not.
Whether you need it or not.
Don't you find that a bit?
I have mixed feelings on that, right? Because I understand if I'm not taking any medications, why should I pay, you know, $18, $20 a month for a drug plan? But sometimes I feel that way about my car insurance and my house insurance and all the other insurances that I pay monthly. And I haven't had a house fire, knock on wood, but I'm insuring against high cost. And the medication side is no different, because I've had
Doesn't that
people
make you worry
calling.
about the society we live in?
What's that?
Doesn't that make you worry a little bit about the society we live in?
About the high cost of medications?
Well, in this case, you just mentioned the high cost of everything.
Oh, yeah.
I can't change that.
I can't imagine a lady winning $100,000 and not being able to feel free to spend it, and to have the government interfere and say, it's not right.
It's not right.
Where's the meeting where we get to talk to people that can make changes?
It's not this one.
Huh?
It's not this one. I'm only
Well,
the
that doesn't answer
messenger.
my question. Can you offer suggestions maybe at the end of the meeting where one could meet with?
There is a state rep here.
And our Deb, Representative Dubois Aide. I'd be happy to take your name and any questions and bring it back to us. We can talk about it for another
I can
time.
tell you who I am, and I can tell you that, but are you listening? Is all I
I
can.
am listening. I am listening.
Please continue, I'm sorry.
Thank you. That's okay. Get where I was. Prescription drug coverage. So we know, yes, we need everyone to have a Part D plan, and that is to be insured against high
You're
cost
nodding, but I'm
medications.
shaking my head.
I know you are. But I can't tell you the amount of phone calls that I get from people that weren't on medications for many years and went to the eye doctor and now need an $800 eye drop. Or an inhaler, a $600 inhaler because they have a cold. And they don't have or never needed it before, and now they need it, and I can't give them to them. Why? Because it's structured as you have to get a drug plan within certain time frames of the year. And if you don't do it during open enrollment or during when you first came on to Medicare, then I can't get it for you. So you could go a whole year not having, the prescription drug coverage. So it is a bit of a catch-22. But I do need everyone to be on drug coverage, even if you're not on any medications. I'll put you on the lowest premium price one that we have. But I want you to have coverage so that when you are put on that eye drop or that inhaler or any other high-priced medication, you will have the coverage for it.
So in other words, what you're saying is you don't necessarily have to go forward and buy drug coverage, but if the proverbial hits the fan, you bite the bullet. Right on.
For a year,
Gotcha.
until the next open.
And then you'll have a penalty.
But keep in mind that you'll have a penalty.
I understand.
Right. So not only will you not have drug coverage,
I'm just saying.
So not only will you not have drug coverage, when you do put that drug coverage in place, you'll end up paying more for it because the penalty will be in place. For every month that you went without that drug coverage and you should have had it, you're going to be penalized, it's about 33 cents on the average a month, and then that figure is added to the monthly premium going forward for your lifetime. So it does behoove everyone to get a drug plan, even if it's a low-cost one, just to have one to insure yourself against high-cost medications. Because I get the phone calls all the time for the folks that didn't, and now the proverbial has hit the fan, and we're trying to fix things on the back end. Okay. So this year, 2017, there are 24 drug plans. So every year, the amount of drug plans that we have to choose from are going lower and lower, good or bad. We'll see how it goes. So what we do as Shine counselors, and what I would advise everyone to do as Medicare beneficiaries on prescription drug coverage, is to look at what is going on with these plans. Every year, as far as changes go, drug coverage is what changes the most. They change their premiums. They change their deductibles. They change their co-payments. They changed the tiers that they put medications on. They changed the restrictions, and they changed the co-payments at the pharmacy, and they changed what their preferred pharmacies are. They have all kinds of changes going on within those drug plans. So Medicare open enrollment is so important to take a look at, what am I on? What pharmacy do I want to go to? What out of the 24 plans is going to be the best one for me? I don't want to pay more than I have to. I don't want to pay higher co-payments than I want to. I want to know if I go to Walgreens, they're going to charge me $1. If I go to CVS, they charge me $5, or vice versa. I want to know what's going on. I want to know how to get my medications at the lowest cost. And if you stay on the same plan year after year after year because it's working for you, more likely than not, you're paying much more than you need to. You really need to take a look at it. If you have friends that didn't come today, please tell them to take a look at it. We save people a lot of money just by switching a drug plan or switching a pharmacy. You never know. So it's worth taking a look at.
Just as to emphasize that, I had, the firm that I worked for was exceptional. We had Blue Cross Blue Shield, Blue Medicare RX. I thought, okay, how can it get any better? We were paying $127 a month, each one of us, for drugs. We are now paying $27 and $25 and getting the same coverage.
You're saying $50.
Now, we have a deductible, but the deductible doesn't even come close to what we were paying in premiums because we didn't know any better till we came here.
We saved $1,500 the whole year when we did that.
I get a lot of those stories. I mean, minimally, I see probably a couple hundred people during this open enrollment, and I'm generally saving people on the average, $100 to $300. I've saved people thousands of dollars. It depends on what medications you're on, but it's always worth taking a look at, because even if you can save yourself $20 a month, that's a lunch out with your friends. Why give it to an insurance company? Take it for yourself and go do something fun with it. So drug coverage, you want to take a look at it. And what we do is we use Medicare's website, medicare.gov, which is a public website. Anyone can go on and put their medications in. We want to know exactly what you're on, what the milligram is, how often you take it. We're going to put it into that plan finder on that website, and it's going to tell us who the best drug plan is based on the pharmacy that you're going to go to. So it's a great exercise. Shine counselors can do it for you really quick because we do it all the time. So if you want to try it yourself, that's great. If you want to try it yourself and then just kind of go over the results with us to make sure you think you're on the right track, you're welcome to do that. You can call us at the regional office. You can call Wendy. You can call Fran. You can call any one of us to just double check. If you don't want to even try it, just call us with your Medicare card information and your medication list, and we'll do it over the phone for you as well. Okay? So, if I want original Medicare as my primary insurance because I want the freedom and flexibility to go wherever I want, then I'm picking a standalone drug plan for my prescription coverage based on the 24. We'll find the best one. And then I'm looking at this third piece. Who can tell me what the third piece is? It would be a Medicare supplement. So when we went through that green page and I talked about that deductible when I'm in the inpatient, that $1288, and on the Part B side I talked about that 20% that would be my responsibility. I'm not too crazy about picking up those costs. What I'm going to add is a Medicare supplemental policy, because that's going to be the secondary payer that's going to follow Medicare around. Medicare is going to be my primary, so they're going to say you can go wherever you want and I'm going to pay this much. That secondary, that Medicare supplement, is going to follow Medicare around, and the stuff that Medicare doesn't pay is going to drop to that secondary, and they're going to be a unit. They're going to move around as a unit together. Okay, so let's go to the white page with the dark blue stripe across it. Looks like this. These are a listing of your 2017 Medigap plans. Okay, now you notice there's the same cast of characters are selling it. We have the Blue Cross, Fallon, Harvard Pilgrim, Health New England, Humana, Tufts, and United. They're all selling these Medigap plans. If you remember from last year, there are two types of supplemental policies that you can add to Medicare. That's it. It's either a supplement one or it's a core. So if you could do me a favor and look where it says supplement core and go down that column, let me know who is selling that Medicare core for the lowest price. Blue Cross and Blue Shield, right, at $93.61. Who has it for the most?
I have it for 183.
We're talking about the core. Okay, so if we're looking at the core coverage, Humana, so Humana is selling the exact same product for how much? $163.45. That is a big difference in premium for the exact same product. Let's do the same exercise for the supplement 1. So we go over to that supplement 1 column and we look at all those premium prices. Who has the lowest premium price? At $183.10 for next year, right? Who has it for the most money? Humana for how much? $260. So you have $183 versus $260 for the exact same product. So who are you going to buy it from? If you're going to buy it, you're going to buy it from Blue Cross because they have the lowest premium price. So when you hear a lot of your friends saying they have that MedX Bronze or that MedX Core, it's not because it's any better than any of these other plans. It's what? The least expensive. And why spend more money for the exact same product? So that's why you hear people tend to have that Blue Cross MedX Core, that Blue Cross MedX Supplement 1, or the Blue Cross Bronze, because it has the lowest premium price. When you turn that paper over, so that we're looking at it this way, okay, so we know there's a big premium difference between the core at the 93 and change and the supplement 1 at 183 and change. I don't have these figures in my head yet. Clearly there has to be a benefit difference, right? So when you look at that last column, well, first let's start with the first 2 columns. The first 2 columns are the same as the green page, so we already went over that. The first 2 columns are what your out-of-pocket expenses are if you had just original Medicare and didn't add anything to it. And you see all those out-of-pocket expenses that we talked about. There's that $1288 in the hospital. There's that $166 and the 20% under Part B. Now let's look at the last column where it says what your costs are if you added a supplement 1. What do you notice all down that column?
Zero.
Nothing. When you add a supplement 1, which is the higher priced supplement, to the Medicare, your out-of-pocket expenses are 0. So you write that check to the company every month, and you can go to the doctor, the hospital, the specialist, the ambulance, everything. And are you going to pay a copayment?
No.
No. Are you going to get a bill? No. If it's Medicare covered, obviously, then you are not going to have any out-of-pocket expenses. So if I'm a Medicare beneficiary, and maybe I am on oxygen, maybe I find myself being admitted into the hospital every spring when my allergies kick up, maybe I go to a lot of specialists, I'm back and forth, I take a couple ambulance rides to the hospital every once in a while when I can't get my breathing under control. Would this be a plan for me? It would be a good plan for me because I'm going to get my money's worth out of that $183 because I'm not going to pay anything as I use the system. If I'm a healthy person and I go for my maybe 1 sick visit, 1 healthy visit in the year, is this a good plan for me? Maybe. If I feel like I want to be that insured, maybe. Maybe I don't. Maybe I feel like $183 every month is a little too much. I don't need that kind of coverage. So I may want to look at the core coverage. It's a little less every month, 93 and change. It's not going to give me the full coverage, but it's going to give me good coverage. And let's look to see what coverage it's going to give me. So let's look at the column where it says the core. All right, everyone following me? Okay. So if I have Medicare as my primary insurance and I add that supplement core, if I go into the hospital and if I'm admitted, am I going to have to pay that $1288? Yes, I am. I am going to have to pay that bill. If I have a long stay, however, am I going to have to pay any of those per day fees? No. So I'm going to pay the $1288, and that's my financial responsibility. So if I spend 60 days there and I have a $20,000 hospital bill, my only responsibility is going to be the $1288.
Tracy, even if you stay one day, you have to pay.
Probably costs are gonna run 1288. I mean, I couldn't say 100%, but probably. Good question. Skilled nursing. So if I had a surgery, they send me off to rehab, if I stay longer than 20 days and I have Medicare and I have the core, is it gonna help me out at all? No, I'm gonna have to pay that per day fee. Let's look under Part B, because this is where the core is really important. Under Part B, if I have Medicare and the core, I'm going to be responsible for the first $166 deductible, but what is that core coverage going to cover that's so important? The 20%, right? So here I am. I think I'm a fairly healthy person. I probably am going to go to the doctors. I probably might see a few specialists. I might even have to go to the emergency room. So I'm really looking for more solid Part B coverage. That's what the core is going to give me. Because all I have to do is out of pocket $166 one time in the year, and then I really have 100% coverage going forward for anything under B. And B is what we use more. So not a bad deal, the core plan. Now we like to know, you all need to know, and this is what everyone is so excited about, is that these have continuous open enrollment. So typically Medicare has their fingers in things and they say, oh, you can't change during, you can only change during a certain time of year. With these, you can change them anytime throughout the year. And it would go into effect the first of the following month. So if I started with the core, because I'm healthy today, and I feel like that's all the coverage I needed, but maybe my health changed, or I can anticipate a surgery down the road, I could call whatever plan I bought it from, increase to the higher coverage, and it's going to go into effect for the first of the following month. That's a great benefit. There's no pre-existing conditions at 65 and older, so it doesn't matter how my health changed or why I'm changing it. I'm allowed to make that change. And vice versa. Maybe I'm on that supplement one, and after writing that check a few times and thinking like, wow, this is a lot of money every month, and I don't really feel like I'm getting a lot of benefit from it, I could call Blue Cross or whomever you bought it from and drop down to the lower plan and stay with that for as long as I need it. First of the following month though, so nothing changes with Medicare in the middle of a month. But that's a great feature, a little flexibility when it comes to the supplemental policies that a lot of other things in Medicare don't have. Okay? All right, so that's one choice that Medicare beneficiaries have, is keeping the original Medicare as the primary insurance, adding a prescription drug piece, and then adding a supplemental policy, whether it's a supplement one or whether it's a core. Any questions on that? Another room of experts. We're killing it.
Do they take those out separately, or do they take them right out of your Medicare if you want them to?
The supplemental policies are not going to come out of your Social Security check, so they're going to bill you separately for that. I think you can set it up with them to have it come out of like a local bank, but it's not going to touch your Social Security check. The Part D plans will come out of your Social Security check if you want them to. As Shine counselors, we kind of advise people not to do that, and the reason being is that because we want you to change these plans every year, we want you to be really diligent in possibly changing these plans every year. Sometimes it takes Social Security a little while to make that switch, and you could be paying 2 premiums for a few months while that's happening, and we don't want anyone to get stuck paying 2 premiums while they're waiting for Social Security to kind of undo it. You always have the option to have something come out of a local bank where we can just go and stop it, so that's not a bad idea if you want it direct coming out of something local. But Social Security, you don't really want too much coming out of that if you don't have to have it come out. That's a good question.
Blue Cross Blue Shield bills quarterly if you have the,
Right. Well, I have Blue Cross now, but they take it right out of my Social Security. I do that with Blue Cross.
You have an Advantage plan then?
PPO.
Yes. Okay, so we're going to talk about that next. That's a good segue.
Right.
Okay, so the next option that we have is, if you're not interested in that piece, we have what's called the Medicare Advantage plans, which is Medicare Part C, and that's the yellow. And you'll notice it's all one color because these are all-inclusive plans. So on the other side, I'm talking about A, I'm talking about B, I'm talking about drugs, I'm talking about a separate supplemental. These plans are your hospital, your medical, and your prescription coverage all wrapped together in one local plan. Makes it sound kind of easy, right? You don't have to deal with all these cards, you don't have to deal with all these bills coming in, you get the one bill from the one company, you're carrying around the one card, and you're good to go. There are some downfalls to this side, however, so we want to make sure that everyone is aware of those, right? So let's go yellow to yellow, we're matching up our colors. And these are the Medicare Advantage Plan prices, premium prices for 2017. Same companies are going to sell you Advantage plans that kind of would sell you the supplement policies. You have the Blue Cross, you have the Fallon, you have the Tufts, you have Harvard Pilgrim, and you have United. Same companies. Now, these plans take a little more homework to figure out which is the best one. Can anyone tell me why? Why it would take a little more homework for these plans? That, but something else that's even bigger. How about the network? Well, the network, right? When we have Original Medicare as our primary insurance, I told you could really go pretty much anywhere you want. When you have a Medicare Advantage plan, what happens? You have to stay within a local network of physicians that have signed the contract with that particular plan. So you don't have the option to go wherever you want anymore. You need to stay within a network of providers. So if I'm on the Tufts Medicare HMO, I can only go to Tufts Medicare HMO doctors. So you want to be sure when you're looking at these Advantage plans that you're taking that into consideration. Now, does anyone have the Tufts HMO, Medicare HMO that the steward just dropped in here?
Steward drop?
Mm-hmm.
I know.
No one. All right, so the biggest news that came out in the last 2 weeks, or a week and a half probably, is that steward doctors did not renew their contract with the Tufts Medicare HMO. So if you go to Compass Medical, they are not going to take the Tufts Medicare HMO as of January 1.
I know a girl who had to change all doctors because
It's happened. It happens. When these physician groups don't renew contracts, then when you're on these Advantage plans, you kind of have to do a little scrambling to either go back to Original Medicare or go on another Advantage plan where they did sign the contract. So Compass, Steward, they signed the Harvard Pilgrim, they signed the Blue Cross, and they signed the Fallon. But they dropped the Tufts HMO. So we're going to be very busy in our office with these folks because that's a lot of people that are now in a plan and they can't go see their doctor. So is it you change your plan or you change your doctor? Do you really want to change your doctor? No. So therefore, these people are going to be changing up their plans.
Yeah, the doctors.
Yeah, it's hard to find doctors that take new patients, right? So we don't advise to change your doctor. We advise you to change your plan. And so these people are going to have to go through this whole process that we're talking about today to figure out where do I need to be because I want to stay with those doctors. Okay, so Advantage plans are network-based. Medicare Advantage plans also have co-payments that you mentioned, right? So every time a service is rendered, you're expected to pay some type of co-payment, some type of set fee for that particular visit, whether it's an office visit with your primary, an office visit with a specialist, when you go to the emergency room, if you take an ambulance ride. And when you look into the details of these plans, which I didn't provide because it would be microscopic and printing, and it would be a few pages long. But Shine counselors have all of that detailed information that we would go over with you when you came for an individualized visit. And we would be talking about how comfortable are you with paying the $20 to your primary or $45 to your specialist. How comfortable are you when that plan says, you know what, if you take a Part B medication, which would be things like chemotherapy or anything else that is infused, how would you feel if we charge you 20%? How would you feel if we charge you 15%? Do you want to pay that? Are you comfortable paying 20% of a chemotherapy session? Are you comfortable paying 15%? So those are the details that we want to look at when you're looking at these Advantage plans, because when you just look at just Blue Cross because alphabetically they're first, if we look at their Advantage plans, you know, we see an HMO for $39. And you think, wow, well, $39 is going to be my hospital, my medical, and my prescription coverage. That sounds quite attractive, doesn't it? Well, you really want to drill down to, well, that's great, but how much are they going to charge me when I go to use it? Worst case scenario, right? I want to know exactly what they're going to be charging me. And so it's a whole picture that you want to look at with these. And the third piece that you had brought up was your prescription drugs. So your prescriptions are included in that one plan. You have that one card that you're bringing everywhere. And that's your prescription coverage too. So not only do you need to look at the doctors that they've signed the contract with and their out-of-pocket expenses, but you're also looking to see what? They cover the medications that you're on, and what are they going to charge me? So that's why these can be good plans, but you can see where it would take a little more research to know which plan is the right plan on these. So if if I go back to, I'm a Medicare beneficiary and I'm on oxygen, and I'm at the hospital in the spring, and I take a few ambulance rides, and I have a lot of specialist visits, would this be a good plan for me? Probably. What do you think?
No.
Maybe not. Because I might be spending a lot of money every time I use the plan. And if I'm using that plan a lot, I'm constantly paying out co-payments. So maybe this isn't the right plan. Maybe I would be better off using the original Medicare. But on the other hand, if I'm healthy and I just go for a few visits a year, would this plan work for me?
Yeah.
Sure. I could save a lot of money every month on these plans. But once I'm in this plan for the year, can I just drop it any old time?
No.
No. So all of a sudden, if my health takes a change, I cannot come out of this plan because I'm in it for the year until the next year. Now, luckily, all these plans have their out-of-pocket maximum. So if worst case scenario happened, I'm not going to constantly be out-of-pocketing my money. They all cap out around $3,400, $3,900 for the year. So when you take that into consideration, it might be still a good plan to have. And we would have all that detailed information. I'm trying to think, did I cover everything on Advantage plans? Any question on Medicare Advantage plans? All right, so if you have friends out there that have gotten the letter from Tufts HMO and that go to the Compass or any of the Steward doctors, this is what they have. They have to make a change if they want to stay. Don't ignore the letter. I know change is hard for everybody. Nobody wants to make a change, and especially this one, where they don't even understand what all of this is. It's a big bunch of gobbledygook, and they just don't know what options are out there, or even that Shine is out there. So if you can help me spread that word, that if they're out there, just give us a call and we will walk them through it. Okay, so we went through original Medicare and the options on that side. We went through Medicare Advantage and the options on that side. Now, something that they both have in common when it comes to the prescription drug coverage is what? Someone in this room knows. It's not a positive thing.
The gap.
The gap, which we like to refer to sometimes as the donut hole or the coverage gap, right? So when you go to the blue paper, it's going to talk about Part D. So no matter how you're getting your prescription coverage, whether it's through the standalone plan because you have original Medicare, or if it's included in your Advantage plan, they all have a standard benefit. And I'll just go through it for you. So next year, 2017, what it's saying is the deductible could be as high as $400, which when that number hit me, I was like, whoop! Not all plans are going to have a deductible that high. Some may have no deductible at all. Some could have something anywhere between 0 and up to $400. But you have to know that there are some plans, and there are quite a few, that are using the $400 for their deductible. So what does it mean when a drug plan has a deductible? Can anyone tell me? Exactly. You pay full price for your medications until you've spent that deductible amount, and then you get to go into the co-payments. So if you have a high deductible, you know, your beginning of the year is going to be pretty significant, trying to pay full price for your medications. Now, a little trick that most of them are doing this year, and they've done it the past 2 or 3 years, is even if they have a deductible, they're going to say, well, you know what, if you're on Tier 1 or Tier 2 medications, which are the generics, not too high cost. We're not going to apply the deductible. We're going to give it to you for the co-payment right off the bat. But then the minute you come to that pharmacy and you want to fill a brand name medication, that's when we're going to apply the deductible to you. All right, so you have to know that that's going on with a lot of the plans. Tier 1s and 2s, which are your generics, not necessarily are they applying the deductible, but those brand names, they are definitely applying the deductible to. All right, so you're going along, January starts, you're picking up your medications. What is Medicare doing in the background? Does anyone remember from last year? What's Medicare doing? They are tracking the cost of the medication that you picked up. So you picked up that inhaler in January. You might have had a $45 copayment, but the inhaler really cost $600. Medicare says, yep, $600 to them. February, same thing, you go, you pay $45 for your inhaler, that's another $600 cost. Medicare says another $600, they're at $1,200 already. And when Medicare's cost behind you has reached for next year $3,700, that is when you're going to fall into that coverage gap. So it's not your co-payments that Medicare is tracking, it's the full cost of the medication that Medicare is tracking. And when the full cost of that medication that you've picked up next year reaches $3,700, you fall into the coverage gap. What happens when you're in the coverage gap? Are we partying? No, right? Because now the co-payments that we were paying go away and we're responsible for a percentage of the cost. So if it's a generic, if it's a brand name, we're going to pay 45% of the cost. And if it's a generic, we're going to pay 58% of the cost. So our co-payments are going to go up. And they're going to stay up until we possibly out of pocket $49.50, and then would be catastrophic and they would go down. But what do we have in the state of Massachusetts to protect us against this coverage gap? Does anyone have it? Does anyone know? Prescription Advantage, right? So we have a state assistance program in the state of Massachusetts called Prescription Advantage, based on income, not assets. So we have a lot of Mass Health federal programs, Mass Health state and federal, to help us with some high costs, but those are all based on your income and your assets. So a lot of folks won't qualify because they may have a 401k in the bank. But Prescription Advantage is a state assistance program that doesn't look at your assets, they're only looking at your income. So we have a lot more people qualifying for that than we do maybe on the Mass Health side. And sometimes we have the rep from Prescription Advantage come, but I'm by myself today, and I forgot to bring her handout. So what I'll tell you is, I'll give you the monthly income guideline, and then you can go from there. So if you are a single person, as long as your gross monthly income is not higher than $2,970, you could qualify for Prescription Advantage for free, and when you hit that coverage gap, it's going to come right in and alleviate the high cost copayment. So again, for a single person, it's a gross monthly income no higher than $2,970. And if you're married, you combine your gross monthly income, and it's going to be $4,005. So if you fall within those ranges, I would strongly advise to do the Prescription Advantage application, because once you're a member, you're a member. It's not something that you have to requalify for every year, and then you will always have that protection. So even if you're not one that hits the donut hole every year, it's great to have the protection. If you qualify, it's free. You have it in your back pocket. You'll always have the protection. You don't have to pay anything for it. And the other nice thing that Prescription Advantage does is that it gives you an opportunity to change your plan one time outside of open enrollment. So say you picked that drug plan during open enrollment based on the medications that you're on. And then in March, the doctor puts you on this new medication, and your plan really doesn't cover it that great. Puts it in a really high tier with a really high copayment, or maybe puts a lot of restrictions on it, and you think, well, great, I'm stuck with this anyway because I have to wait for the next open enrollment. If you're a member of Prescription Advantage, we could get you out of that plan and onto something different. So it gives us a one-time change that plan opportunity. So it's a great thing to have in your back pocket if you can have it for free. There is a higher income bracket on that Prescription Advantage as well. You have to pay $200 into it, and it doesn't work quite the same way. So if you're hitting the donut hole, or you're interested in Prescription Advantage, you could let Wendy know, and she would kind of guide you through, or you could call the regional office and we would guide you through that process too. Very simple application, probably one of the easiest ones that we have going. So it's very easy to apply, and then once you're a member, you're a member. So I can't stress enough how great that is. If you know of anyone else struggling with other costs on the Medicare side, have them call us. We'll screen them for any other assistance programs that we know of with the Mass Health. And if you're a veteran or a widow of a veteran, there's always Chapter 115. So you should be talking to your veterans agent about possible benefits through the Chapter 115 on the military side.
I think you did a great job.
All right, are there any questions? Yes.
What dismays me is you get a certain portion, which I am in, and because of the high taxes that I pay, which are extreme at this point, I'm now 82 years old. I have already put my estate in order, and when I say this, I'm also paying my daughter's mortgage per month. I banked on what I was going to get from Social Security, which my husband had paid in, and I've been working for 66 years. I still work. The point is, I get no salary. I work in my son's office, and I turn the business over to them, which was left to me. I just feel like I'm disadvantaged at this point because I'm trying to hang on to the house, which I really wanted to stay until I die. And I'm struggling because I have a disabled son now because of divorce and disability problems, which I'm paying a lawyer for that. I'm right up to beat. I want to get out on a platform and just scream. Because, you know what
let
I'm
me
saying? Excuse me, they based it all on my 2014 tax payment. You've got me paying all this, and then you hit me again.
Are you talking about the IRMA tax?
What, please?
Are you talking about the IRMA tax?
I don't know what that is.
Okay, so just so that everyone knows, when it comes to the Part B premium that one pays, and then the Part D as in drug premium that one pays, if you're in a higher income bracket, they will tax you a little bit more for the premiums. And they base it, unfortunately, on 2 years prior. So, which is bizarre because you could be working and have that income from working, and then you retire, and yet they're basing your new premium on what you earned 2 years ago. You can go to Social Security and ask them to review that. And people do that, and it's been done, and they don't have to pay that IRMA tax.
That's what I got, was the complete brush up.
It sounds like you might want to make an appointment with a one-on-one, and then we can kind of go through your
She
stuff.
says, oh, it's the government. She says, there's nothing we can do for it.
And that,
That's what I got for it.
to me, that might be the answer, because I can't change
I
the
know, I'm
government.
not blaming you per se, I'm just trying to make a statement.
But have you met with Wendy yet?
Yeah, there was a small minimum amount, she thought perhaps you could take it out of the drug plan. But that was last time, and what's the point of $24? I'm just dishing it out every which way anyway.
Well, 24 times 12 months is, I think,
It's a drop in the
reasonable.
bucket. It's a drop in the bucket.
So any other questions?
Not when you're paying $7,000.
All right, so I urge you to tell your friends, Medicare open enrollment, right through December 7th, have them review what they've got, make sure that we can maybe save a little money going into next year, and that's all I've got. Thank you.